Good evening, everybody. This is Sean Byrne, RNBC. I'm here to review and present some information from the book on chapters 22 and 24, dealing with disruptive staff problems and preventing workplace violence. Some of the objectives I'd like to include in this presentation are identifying harassing behaviors, including bullying, incivility, and lateral violence, discuss how to handle these behaviors in the workplace, talk about substance abuse in the workplace for nurses, as well as a review of professional literature about those topics. Also, I'd like to talk about with Chapter 24, the occurrence of violence in healthcare, discuss what healthcare organizations can do to prevent workplace violence, discuss how to respond and follow up to a violent incident in the workplace, and also go over some literature review about workplace violence and an interesting simulation associated with that for nursing students. Harassing behaviors in the workplace. A lot of us have experienced it and probably have a tale to talk about that when we bring this topic up. So let's define it. Bullying threatens the victim and poses a danger to patients. It ranges from mild verbal remarks to dangerously violent attacks even. It can range from even something as simple as a silent treatment or verbal abuse to dismissive body language, sexual harassment, or an actual physical attack. Incivility and lateral violence are two also prevailing behaviors that we see as harassing in the workplace. This includes being rude or disrespectful to others, impolite or ill-mannered, yelling or spreading rumors about other staff members, which then can lead to the aforementioned lateral violence, which is actual harassment between employees of equal rank. So those two topics we can clearly see are problematic, and nobody would want to work on a unit like that. So what can we do about that? First, we want to try to identify what causes these things. So they are attributed to complex staff problems that we want to work with our manager with and help our manager identify these types of employees so that we can either correct behaviors or instill or act on actual measures to discipline this person that's acting like this, because obviously we don't want to work with these types of people in our unit, but also there are certain circumstances that arise that would make employees either disgruntled, or even a lack of training can cause these employees to fall into the category of marginal employees. So what is a marginal employee? This type of employee never reaches the level of competence expected of an experienced nurse, no matter how much precepting has occurred. This really takes a toll on the unit and the morale of the unit, because experienced staff are then expected to maintain the workflow for those employees that aren't picking up their own slack. So what we ask our managers to do for us is have these crucial conversations and follow through with actual formal corrective action. So therein lies the issue. We have to make sure that we are accountable for our communication with our manager. So that becomes very essential moving forward. So how do we deal with disgruntled employees? This is that person that's on your unit that is always complaining. They affect the morale of the unit. They tend to direct their complaints against the actual organization, whether valid or not. And we are expecting our managers to intervene on a peer-to-peer level or an actual manager to employee level, just to set clear standards of what's expected of them while they're working on the unit. Managers must be very consistent with these employees about what's expected of them about workplace behaviors. So moving over to another topic that we talked about in this chapter, which is substance abuse in the workplace. It's very prevalent in healthcare for nurses to abuse drugs such as prescription drugs, or even stealing drugs from our Omnicell or Pyxis units that we have on our various hospital units. So I want to help you guys identify what substance abuse looks like and what we can do to intervene on that once we see these actual signs and symptoms. So they can range from the shakiness, tremors, slurred speech, unsteady gait. If in conversation you find out that the person has a family history of alcoholism or drug abuse, this person can have mood swings, depression, suicide attempts. If they're disclosing that kind of information with you, it's best to be a good friend and a good coworker and help this person out. So another way that we can actually identify the substance abuse is through things we see in the behaviors at work, such as those incorrect narc counts, high wastage of those narcotics, inconsistency with those narc counts, as well as patient reporting pain medication that is ineffective. So, the person's taking their pain medication for them, therefore they are not getting their medication, so they're rating their pain still as a 10, and it probably should be like a lower number at that point, but the nurse had taken that medication. So we also want to keep an eye on those corrections on the medical record. Every time we don't scan a barcode, it can be a little misleading to thinking that we're not actually administering those medications. So what do we do about that? It's definitely reportable. We want to help the nurse. I think that when we look at this issue, I think we need to continue to look at it as a problem that needs to be addressed as an illness, so that our managers can help assist our colleagues through this tough time, whether they're abusing drugs or alcohol or what have you, because of something that might be happening in their life or because of their lifestyle outside of work. We want to ask our managers and look to our managers for some of these resources, because they are going to be able to help them out more with checking on insurance, maybe involving human resources in the supervisor if there's actually drugs or drug paraphernalia on the premises. Might have to escalate it in a rather quick manner if it does happen on your unit. So what we have to do is we have to be strict about these kinds of things when it comes from a manager's perspective, because we don't want to have a culture where that kind of behavior is okay. We want to make sure that there's consistent documentation about what's happening. Is it just one source, or are there multiple people saying this? Is it that thing we were referring to before where someone's just spreading rumors? Puts the manager in a tough position where they have to sift through all this information and find out who's right and who's wrong. So then it leads up to where we get to scheduling an actual intervention with management and human resources so that we can actually help the staff member. And then that aspect's more private to the individual, so eventually they will need to come back to work, so we need to help embrace their return to work after they've gone through their struggling problem because it's obviously embarrassing for that person to go through substance abuse. The next part of our book talked a lot about workplace violence, especially what those consequences are to nurses and what the contributing factors are to getting to the point where patients are assaulting staff or staff are assaulting each other. So, workplace violence includes the following definitions as any violent act directed at staff at work. Most of these assaults are by patients. They include verbal and written threats, actual physical attacks and violent assaults. Violence mostly occurs, or should I say, violence occurs more frequently in healthcare, which is an interesting fact considering what police officers do for a living. You'd think it would be them, but very interesting that healthcare is on the top of that list. This also leads to an increased number of assaults in the healthcare facility. So the consequences to the nurse are ranging from actual physical disability to the psychological disability of PTSD and even death. I had even read in our book that it is extremely common within emergency room nurses. Almost up to 94% of emergency room nurses experience at least one symptom of PTSD. So we can see there that most likely to occur in psychiatric emergency rooms or waiting rooms are these violent behaviors, because they're really seeing the patients at their worst, and psychiatric care is one of the most demanding jobs as a nurse, so seeing that at the top of the list isn't this very surprising to me. So if we've seen this on the unit, it increases the staff stress, obviously, and it can sow distrust within the staff against the administration if they're not feeling protected. This can then lead to increases in absenteeism and turnover, which is a very vicious cycle that includes increased healthcare costs. So some of the contributing factors that can kind of breed a environment for violence is poor staffing ratios, overcrowding of waiting rooms and hospital units, as well as inadequate security, poor lighting. So what can healthcare organizations do to protect us? They have, and we can even see this at Lancaster General Hospital, that they do have a zero tolerance policy that's very clear and direct about the consequences to workplace violence. I don't know if anybody else has had experience with this, but you can ask your security guards to escort your patients' visitors out of the room if they are being violent or being abusive towards a patient or even a nurse. Now the difference is with the patient, it's a little bit more gray area involved in that. So what we want to do is continue to educate our employees about the warning signs of that violence, that potential violence that we might see, and then educate about the awareness of the use of weapons in that instance. So when we're in our patients' rooms, we want to pay attention to how the patient looks. Obviously, if they're clenching their fist, if they're in a kung fu position, they're ready to pounce, they're ready to punch you. If they're going to even use your stethoscope as a weapon, they can grab anything from a pen to scissors to what have you. And just kind of having that awareness and of what those potential weapons could be and making sure they're out of the reach of the patient, especially if they're independent and mobile. We've even seen on our unit a patient had used a IV pole as a weapon, had picked it up literally and tried to swing it at us. So that was an interesting night for sure. So what do we do when these things happen? One thing I didn't list there was contacting your supervisor and manager about these events, but we want to make sure that we promote an environment of safety, including actual physical things in the unit, like security devices, like those panic buttons, as well as curved mirrors in hallways so that we can see around them if there's any danger around those corners there. And we want to make sure there's adequate lighting in our hallways. We had talked about, even at the hospital, about doing adequate lighting in the parking garage, and then the infamous adequate staffing ratios that we seem to be chasing as a profession. So the last thing is promoting safe self-reporting. Now, what do I mean by that? I mean, I want to make sure that we have an environment in a hospital setting where we feel safe to report any violence towards us, whether that be the actual bullying from our coworkers to lateral violence to actual physical violence from patients. So we have to feel safe with administration and with managers to do that. And we want to make sure that we're using our MIDAS reports to do that as well. So I'll talk about that here in a little bit with responding to workplace violence. So intervening, we wanted to talk about here the verbal intervention. Like, what can we do first? When we see things are starting to escalate, we want to try to remain calm, isolate the person, but not box them into a corner. We want to just keep it simple, embrace silence sometimes, that's okay. And then maintain moderation in speech. So just like keep a simple voice with the patient and make sure we're not escalating things more. So that's why I mentioned in the next part there about not antagonizing the patient, and then recognizing some of those signs of escalating violence. And we can always lean on security to come and assist us if we're worried about physical violence with the patient and self-harm. And I had mentioned very briefly before about those violent behaviors that we can see, like that a patient might be advancing towards you with a weapon or arms outstretched in a fighting stance or something like that. So follow-up. It's so important to debrief after an incident, and we want to check for safety anytime that happens. So if you'd seen that your colleague had gotten injured, please check on them. And if they need to go to employee health, they can do so. Or if it's bad enough, they should go to the emergency room. So we want to attend to that treatment immediately, complete required reports, follow up with human resources. And then from a manager's perspective, they should be checking in on that employee to make sure that they're doing okay. So some literature that I found about this topic, or these topics, started with substance abuse. Typically, substance abuse among nurses begins early in a nurse's career and usually begins while the nurse is still in school. Misuse of prescription drugs seems to be the initial step of substance abuse among student nurses, whom later suffer from abuse of controlled substances in their workplace. And I found it interesting also in that article, they had said that about 10 to 20% of students misuse prescription drugs, which I found that a fascinating stat. And then bullying, I think that it's unfortunately very well followed in the academic community of nurses about eating their young and bullying, and it's just really unfortunate that that's happening. So just so that you can identify some of those physical symptoms that the victims can even see or you can see in the victim, some signs and symptoms are stress-related weight gain or weight loss, hypertension, cardiac palpitations, and irritable bowel syndrome, and some of the psychological symptoms like depression, acute anxiety, post-traumatic stress disorder, among our fellow nurses. So also with the workplace violence, I did find a nice article that talked about workplace violence in the healthcare sector and how we can use the simulation lab to help newer nurses and student nurses with this idea of workplace violence and how to deal with it. This quote's pretty good from the abstract about their experimental design and the effectiveness of that actual situational simulation. I wish that when we were going to school we had a workplace violence type simulation. We did do simulation during our studies at PA College, but we never did one about workplace violence. Maybe they'll incorporate that soon. So I included a nice little video about violence in the workplace. I'd like to show that to you now.
Hello, I'm Pam Cipriano, President of the American Nurses Association. Nurses expect to work in environments where they will be treated with civility, kindness, dignity, and respect. But here's the hard truth. Bullying and workplace violence are real problems in healthcare. Violence of any form should not be tolerated from any source. Nurses and employers must work together to create strategies that will shift the culture to one of civility and respect, where bullying is not tolerated and where violence prevention and safety measures are a priority. ANA has released a new position statement on workplace violence and bullying that offers recommendations, including setting a zero-tolerance policy, encouraging employees to report violent incidents, and developing a comprehensive violence prevention program. Creating this type of culture helps protect the health, safety, and wellness of nurses, and that's in everyone's best interest. Learn more about this issue and get resources to create best practices at nursingworld.org. ANA cares about you. Working together, we can create a safer and healthier work environment.
Nice little video from the ANA. Continue to recommend that folks join the ANA as a member. Another great video about substance abuse and one nurse anesthetist's story about how she abused even though she never thought she would.
Kyle, he invented one wheel to destroy boredom.
Sorry about that.
I was an anesthesia provider. I was, people's lives were in my hands. I put this person to sleep. They're asleep and having surgery. And I'm thinking about when can I get some more that was safe, because my entire thought process throughout the day was about my disease. And I tried to stop. Every day I'm going to work. Please God, I don't want to do this. I don't want to do this today. I couldn't be in that environment with those drugs that I was addicted to and not use them. I think that people would be surprised at the number of healthcare providers who are impaired and on the job on a regular basis. I spent 9 months active in my disease and nobody suspected anything. And I was permitted to practice on a daily basis, taking care of patients. I know that I was impaired, and if I was able to get away with it for that period of time, I'm very confident that there are others that are out there.
Now that's a very interesting story from her perspective about how easy it was for her to obtain these medications to abuse. So I did want to just include a little bit more information. I did want to include the suicide prevention hotline there, just in case you are feeling like you're being bullied at the workplace and there's a lot of violence heading your way. We want to make sure that people know that, suicide is something that comes across people's minds, and it's happened to nurses before that they committed suicide from bullying. You've seen it in the news, and we just want to make sure that people know that we're there for them. The other thing is, at LGH, we do have our StarNet page that we can fill out our safety nets for any workplace violence or injuries that occur to employees or even patients, or any real reportable event that you might even want to talk to your supervisor if you have questions, or manager about that. Contact employee health if you've been injured. If you've been injured that severely, you need to go to the ER, as well as you want to make sure that you're also reporting any substance abuse problems that you may personally be having with your manager as soon as possible, and you don't want to wait. They're very understanding, it sounds like, if you would have that happen to you, but you would have to present to them first. But if they found out that you were using drugs, it's a little bit of a different story, but you can read more about that on StarNet. And then also one other little tidbit, drug and alcohol dependency are considered disabilities under the Americans with Disabilities Act, and therefore you will still be protected under the law. I do hope that you enjoyed my presentation on the topics. I really enjoyed talking about those videos. They were very interesting, and I wanted to show you my references so that you guys can take a look at those. And then I wish you guys a good night, and I hope that you're all doing well. Stay safe, everybody. Thank you so much for listening.